medical, scientific, professional, academic. Welcome to Midpresso Podcast.
Treatment and Prevention Strategy of Posttraumatic Stress Disorder. Posttraumatic stress disorder, PTSD, is a clinical phenomenon that arises as a result of exposure to severe stressors such as natural disasters, military actions, and terrorism. The article, Posttraumatic Stress Disorder, From Diagnosis to Prevention, presented an analysis based on over 3,000 sources from the PubMed database, dedicated to the topic of post-traumatic stress disorder. Typically, the diagnosis of PTSD is based on a group of symptoms. The pathogenesis of the disorder is multifactorial, involving the activation of the hypothalamic pituitary adrenal (HPA) axis, immune response, and genetic factors. The mechanisms leading to PTSD are not fully understood. It is hypothesized that in response to stressors, the hypothalamic pituitary adrenal axis is activated, leading to abnormal release of glucocorticoids and catecholamines. This subsequently results in immunosuppression and the suppression of various metabolic processes. Treatment and prevention methods for PTSD are diverse and range from psychological to pharmacological interventions. Modern approaches to the treatment and prevention of PTSD encompass a variety of psychological and pharmacological techniques, which can be divided into three groups: primary prevention, before the traumatic event, including the prevention of the event itself; secondary prevention, between the traumatic event and the development of post-traumatic stress disorder; tertiary prevention, after the manifestation of the initial symptoms of post-traumatic stress disorder. While secondary and tertiary prevention offer numerous methods, including pharmacological interventions, primary prevention is still in its early stages. Primary prevention is primarily applicable to populations at risk of developing PTSD, such as military personnel, firefighters, rescuers, and police officers. The foundation of primary prevention is psychoeducation, which includes stress response skills, anxiety reduction methods, relaxation techniques, coping strategies, identification of destructive thoughts and emotions, release of physical tension, decision-making, attention control, emotional regulation control. The potential of pharmacological treatment is directed towards addressing the consequences of stress, including memory formation after a traumatic event. The following groups of medications are used: medications that affect the HPA axis, medications that affect the autonomic nervous system, especially the sympathetic division, alpha blockers and beta blockers, opiates, antidepressants, selective serotonin and norepinephrine reuptake inhibitors, SNRIs, monoamine oxidase inhibitors, MAOIs, antipsychotics, anticonvulsants, and benzodiazepines. The following medications with clinically proven effect in reducing symptoms of PTSD are used: fluoxetine, paroxetine, sertraline, topiramate, risperidone, and venlafaxine. Clinical studies indicate that pharmacological treatment is most effective when initiated shortly after exposure to a traumatic event. However, it is worth noting that research in this field is still limited due to strict and complex ethical regulations. Most guidelines for psychological interventions in PTSD recommend cognitive behavioral therapy, cognitive therapy, cognitive processing therapy, cognitive restructuring, coping skills therapy, including stress inoculation therapy, exposure-based therapies, eye movement desensitization and reprocessing, hypnosis and hypnotherapy, brief eclectic psychotherapy. It is important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan for post-traumatic stress disorder. Psychological interventions can be used individually, in groups, or with families of those affected. A meta-analysis of 32 randomized controlled trials involving 2,935 patients with long-term follow-up of up to 6 months demonstrated the positive therapeutic effect of psychological interventions compared to other treatment methods. Comparative data on the use of psychological and pharmacological treatments for PTSD are not sufficiently compelling to favor one method over another. Moreover, data on adverse outcomes of PTSD, such as mortality, suicidal behaviors, self-harmful behaviors, and treatment dropout, were relatively rare. The diagnostic criteria for post-traumatic stress disorder remain complex and ambiguous, reflecting the insufficiently understood nature of PTSD. The main mechanisms of PTSD involve psychological and physiological alterations at various levels. From a treatment perspective, both psychological and pharmacological methods show significant potential for positive prognosis. However, they require the development of a systemic approach and improvement in symptomatic therapy. PTSD not only causes individual suffering but also disrupts family functioning and poses a threat to society. Future research should focus on preventive measures for PTSD to reduce its prevalence and mitigate the impact of PTSD on families and society.